financial affiliations with any companies. This is just showing you the open technique of layering the implant up. I do crimp the edges with a needle driver around the edges so that there's a softer transition over to the sides. I tend to like to use the preform 1, 2, and 3 millimeters I mentioned instead of actually having to fold it, because there's always a chance of some irregularity when you fold it. But if you use a standard 2 or 3 millimeter pre-made one, then trim down the edges, it's more of a solid ability to get it up there and maintain a smoother nasal profile. If the patient wants better tip definition, I'm going to be using a shield graft, and then what Paul talked about is some kind of cap graft or something to help minimize rotation of it, going about maybe 2 millimeters beyond the actual caudal end of the lower lateral cartilages. You know, when you work with, as an example, some of the Middle Eastern noses, I see a lot of Middle Eastern noses that are reduced so far down that they actually look white, but they don't look white, they look weird. And oftentimes the same thing with Asian noses, we try to use a Caucasian ideal, we raise them so high, they don't look white, they look weird. And so I think you've got to think really operatively about the term ethnic preservation instead of westernization when you're looking at Asian or any ethnic patient in particular. Today, at least, I think that's a huge component of some of the desires. This is just basically stacked grafts that are sort of a oval that's been trimmed around the edges and then stacked on top. This provides a much softer look. It's very hard to show in a before and after the changes, but you can see it in the patient. It's a much more subtle result. This is a technique that's from Dr. Pedroza down in Columbia, and I like this. I did it recently on a patient that had really a complete collapse of the lower nose, and if they've got from a trauma, and if they have a relatively weak ala and you want to bring the whole architecture forward, you can just rebuild the entire architecture using contral cartilage and creating the seagull effect. And you can see with the little Gore-Tex of the bridge, it really just brings back the balance of the nose, and also the entire architecture of the lower lateral cartilage has been restored. This is the book that I worked on a few years ago on the Asian face, and it's been translated into Korean. So I just want to conclude with a couple of major ideas. Just really think about the two big things, which is some of the ideas of the cultural issues, and explore that option with your patient. Maybe there's things that you don't know in terms of motivations that may be underlying their reason to do the procedure. And then also think about some of the ideas of ethnic preservation and not pushing forward to be too aggressive with those changes. And these are just the ideas of just avoiding the dome binding suture, thinking about alar-lobular relationships to make sure that you get a good result in that regard, and then perhaps incorporating some elements of injectable rhinoplasty as needed. Thank you.